It's a pleasure to have you here. Just want to make sure our Facebook's working. We should be in good shape. And yes, we are live, so awesome. And send myself a message quick. Have you here? Just want to make sure I'm in. Send myself a message quick. How's everybody doing today? We'll get started here. All right, we know that we're working, so we're in good shape right now. So I don't need to hear myself. So we are going to be talking about a subject, and I want to go over and give you some great tips and give you some great information. If you're suffering with neck pain, if you're suffering with back pain, if you haven't been on our channel before, we're creating a community of people who are looking for non-surgical approaches to manage their neck or back pain, and without drugs or with the reduction of drugs. And so I'm going to share some great tips with you today over the next few minutes. I think that you're really going to be glad that you were able to join us, and I'll do everything I can to keep it fun, exciting, but I'll let you leave with some great information. And don't forget, we're going to give you, stay till the end. We have a coupon code that I'm going to give you as well for Disc University, which I've never done before, so stay with us. So without any further ado, let's talk about this. So we're going to talk about how to heal your back pain naturally from the comfort of your home. Yes, this can be done. I've been doing this for 24 years. It is possible. I've helped many, many people do it around the world. So if you don't know me, just a little bit about me for a couple seconds. I was on the cover of all the largest chiropractic magazines in the world for the work that I do. And I only show that to you because I hope that you realize that, this is my life, this is my passion, this is my God-given just dream. I'm on a crusade to help people prevent having surgeries done. And there's way too many of them happening right now. Not that some of them aren't necessary, but I'm going to tell you what, if you read what I read and you see what I see, and I work in surgical centers, I see what's happening there. I'm telling you, we're doing way more surgeries. It has become big business. And I want you to have a quality of life and get back to the quality of life you want to have in your life, of being the mom or the dad or the grandparent, going back to work, going on a vacation with the person you love, something along that line, instead of being a victim to failed back surgery syndromes, which are only getting bigger and bigger. So just to give you a little bit more about me, I have the amazing opportunity to work with some incredible people in the world. Jeff Foxworthy, Regis Philbin, Ed McMahon, Suzanne Sommer, Dr. Wayne Dyer, an incredible person if you know him, Sean Mullins, the Indigo Girl Band. So I've been really blessed. Hey, Marisa, nice to have you here. So let's talk about this. So, a lot of people don't know this, but what causes back pain? Well, there's two major causes of back pain. The number one cause of back pain is caused by the spinal discs. The number two cause of back pain is caused by the facet joints. So if you're not sure exactly what both of those are, let's go take a look at them. So this is an intervertebral disc, or we can call it a disc today for short. And what we're talking about is when we look at the disc, if you're having spinal pain, you probably are familiar with it, is this structure that sits right here. Okay, so that's called the disc. The disc is made up of two parts. It has this inner jelly part all through here, and that's called the nucleus. And then you have these outer rings that you can see here in this picture. And they're concentric rings. They're very strong. It's like you holding your pair of pants up, but you got like 12 belts on instead of one. So that's what those do. And their job is to support very strongly that jelly inside, so that jelly can't get out, because that jelly has to act as a liquid ball bearing. That's actually how it works. So we want to make sure that the fibers of the disc are healthy. And if they get torn, like you see right through here, where they got torn on this person, and that jelly now has migrated out, we're going to call that a disc herniation without getting too technical about it. And that is going to be one of the major causes of back pain. And the reason is because it's going to typically press either onto your spinal cord, which is right here, or the nerve branches going down usually into your legs or feet. So the other part of it, and let's show you really quickly because I don't want to confuse you where we're at. So what we're doing right now is we looked at it kind of looking down in, and now we're going to be looking through the disc right here. Okay, so what we're looking at is this bone is clear. So we're looking down through the bone that sits above the disc, and you can see those little fibers in there, and that's what we're going to go look at here in a second. Okay, and the outer part is called the annulus, and those are your belts. And on this picture right here, we're now looking down into the bone. Again, you have your jelly, the nucleus pulposus right here. Here you can see a person where the annular fibers have torn on both sides, and that jelly has now escaped out of the disc and is now pushing onto the spinal cord right here, and also to one of the exiting major nerve branches. So that's going to be a big source of pain. What a lot of people don't realize, though, is that there's another source of pain, and if you see all these little yellow dots that I'm drawing right here, if you see those, okay, so all this yellow area, those are things called nociceptors, and a nociceptor is a pain receptor in the body. So noci meaning pain. So those can get very irritated one of two ways, either pressure on them, or when there's tears to these outer fibers, the annulus, when there's tears like we see right through here, okay, there's chemicals that get released, and those chemicals are called cytokines, and they are chemical irritants to our nerves. So some people think that it has to be a constant physical pressure onto the disc from the jelly, but it doesn't. It can be two things. It can either be chemical irritants or pressure, and most of the time it's both. So when we're managing and helping you heal disc pain, we want to make sure that we manage both of those for you. We want to help suck that disc material back in and also reduce cytokine release so you don't have those chemical irritants bugging those nerves. What's the other cause of back pain? Well, it's the facet joint. And the facet joint is this joint right here. And so you have one part of one bone that makes up the facet joint, and then you have the other side there, and the joint's this space in between right there. So it's called the facet joint. Why does that cause issues? Well, if they're like this, then that facet joint is starting to become arthritic. That's what these big pieces are. They're not supposed to be like that. Okay, they're supposed to be smooth, and that can become a very big source of low back pain. So here you can see a person getting a facet injection, and what are they trying to do? Well, they're trying to temporarily numb it. So you can see how the nerve branches come up and they wrap around the facet joint like this. Okay, so that's number two cause of pain in the low back, and usually, most of the time, if you go to a pain management person, you're going to be seeing where they're typically going to do a facet injection into that and see if that helps you with your pain. But you got to remember, if you're having discogenic pain, or even if you're having facet arthritis, numbing it with a facet injection is just a temporary Band-Aid. So the question you really have to ask yourself is, do I want to patch it? Like, when you live up north and you have potholes in the road, and they just do the patch. It fills the hole for a couple months, right? And then it starts coming back out as cars go over it. So that's what a facet injection basically is going to do. Or do you want them to repave the road the way it was supposed to? And that's what I want to teach you. How do you repave your spine? How do you get your spine to be healthy again from the inside out? Because it's possible, and you're going to see some amazing changes here in a minute. So let's go take a look at the next slide here. So how do these things happen? Well, it's a great question. And here's one of the ways, and it's posture. So typically, discs and facet joints get injured either from a trauma or repetitive injury, and this can be a repetitive injury. So here's one of the most common ones, right? Is when we're holding our phones and we're looking down at our phone like you see in this picture. And the reason is because it starts to compress our discs, which sit right here. Those discs are only supposed to support 25% of the weight of your head. And when you're holding your phone down like that, you're compressing those things with 75 to 80% of the weight of your head into that, which are huge forces. It's almost 60 pounds onto your discs. So tip number one I'd like to give you today on keeping your spine healthy naturally from home is to hold your phone up in front of you. So how do you do that? Well, you kind of just do it like this. So most people are like that. Put your elbows on your chest, like this. And then just hold your phone like that. It's actually pretty comfortable. You just have to retrain yourself to do it, that's all. So I hope that helps. So that's tip number one, and that's really going to make a big difference for you. I think you'd be surprised. And watch out for your kids, because kids are doing this all the time, but so are adults as well. Oh, sorry about that, guys. Number two is abnormal sitting postures or standing postures. And so this chart that you're looking at right here is an intradiscal chart. What that means in English is how many kilograms of force do we have on our discs in different positions. So let me give you an example. So if you go to bed and you're laying on your back, you have 25 kilograms of pressure compressing your low back discs, okay? And when I say compression, I'm talking about this right here. So if this is a normal healthy disc, compression is that. If I keep squeezing, it gets more and more compressed. We don't want it compressed. We want it to be open like that, okay? So that's 25 kilograms of pressure onto that disc. Well, what if you flip over on your side in the middle of the night? Well, you go from 25 to 75 kilograms of pressure. Well, if you stand, you go up to 100. But most people don't make their life standing. A lot of people are making their life like this, sitting at computers these days, right? So if you're sitting at your computer and you're bending forward like that gentleman is right there, that's 185 kilograms of pressure onto your low back discs. So that is going from you lying on your back to maybe that to that. That's a lot of pressure, especially when people are doing it all day long. So rule number one that I'd like to share with you is to reduce your sitting posture like this. So when people ask me, should I get a standing desk? Well, if I can reduce 85 kilograms of pressure and get you back here for part of your day, your discs are going to be a lot healthier. So that's my second tip, is watch your postures like this, okay? So I hope that's helpful. So how do you go about fixing these things naturally? Well, spinal decompression is the preferred tool from almost all neurosurgeons who will be honest with you about correcting this. So what does spinal decompression do? Well, it takes degenerative disc diseases like you're seeing here, and it helps rehydrate them so that they can become healthier and thicker over a period of time, and getting oxygen, nutrition, and water into the disc for the disc to heal. It's as simple as that. And help suck the disc material back into the position where it's supposed to be. That's what it does. And the cool part is that you can do this from your home. So you can go to a doctor's office and have this done. It's going to be a lot more expensive. And the problem is sometimes is that it's hard to find doctors that are certified in this. So if you're going to go to somebody, if you're going to get this done, please, 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 you're going to want to go to someone who's nationally certified in spinal decompression from at least one university, if not two. So just so you know, for me, I have 6 national certifications in computerized spinal decompression from 2 different universities, and this has been my life for the last 10 years. And and I'm going to show you what I created, so even if you can't find someone, you can still do this from your home. So what's the whole purpose of it? Well, I think we kind of talked about that. So you have a herniated disc right here. Step number one is to start to suck that blue material back off of that nerve branch or your spinal cord. So step 1 to step 2 is to do that. After we can start pulling that blue material back in, that nucleus, now we don't have pressure on the nerve. Now pain can start to settle down because the nerve has the ability to heal. Because when there's pressure on it, the nerve starts to die. It's called nerve atrophy. We don't want nerve atrophy, so we want to get that pressure off of that disc. Then what happens is we go to step 3, where we can start to have that disc sucked back in. And then step 4 is to go where we heal the red part, the annular fibers. And that's how you do it. And it takes about 12 weeks to do it. Some of the research shows 6 to 8 weeks. I'm just going to tell you, in my experience for 10 years of doing this, they can function better at 6 weeks, but if you really want to get them healed really well, it takes about 12 weeks to do it. But time's going to go by anyway, right? So you might as well be doing something proactive and positive. So let me show you a couple cool research articles. So this is a percentage of spinal mobility, pain reduction, and activity after 219 patients that were all getting ready to go have surgery. And they chose not to. So this was out of the Orthopedic Technology Review in December 2003. And it's a pretty cool study. I talked about this 2 weeks ago. So 86% improvement in people's mobility, 86% improvement in almost immediate pain reduction for people, 92% in physical exam findings, that's reflexes, muscle strength, sensory loss, and 84% of them were still pain-free after 90 days. I think that's super amazing. And I see research article after research article after research article saying the exact same things. In my office, I saw a 93% success rate with our patients at 12 weeks. And no flare-ups after that as well, as long as you continue to do decompression once a month to continue to rehydrate your discs. So Dr. Dennis McClure, 3-4 weeks ago, I went over his study. A very famous neurosurgeon in the United States said he saw on patients he was treating, again, all pre-surgical candidates, so he was going to go cut on these people. 20 patients treated with decompression table showed 90% reduction of the nucleus herniation. In 10 to 14 of those patients, they also observed rehydration of the discs. They know on an MRI that the discs were getting brighter. And here's something really cool. Torn annular repair was seen in every patient. You can't do that with surgery. They're trying to do that with disc seal now. But you want your body to heal because your body's going to heal the best. So just keep that in mind, and that's why spinal decompression is so amazing. So let me show you a couple quick pre and post MRIs. So this is a patient, severe low back pain. You can see this herniation right here. You can see this whole herniation right here. This guy had severe sciatic pain, muscle weakness, diminished reflexes, pain going all the way down his buttock or legs. This is 12 weeks later, almost no herniation at all. And what's really cool is when you look at his axial view, which is really the proof in the pudding, where that black material was all gone. Minimal low back pain, was able to work, no muscle weakness, proper reflexes, and was able to go back to his duties. Here's another person. This again is another one of my patients. So, I don't just talk about symptom improvement. I want to show you nuts and bolts that you can heal. Again, a massive herniation right there. That's that herniation on that view. Severe low back pain, sciatic pain, muscle weakness, constipation, couldn't even travel or be an active dad. 12 weeks later, gone. Almost fully vacuumed back into where it was supposed to be. No low back pain at this point. Disc was getting rehydrated. Normal bowel function again, was able to be an active business owner and be a great dad. Here's another person. Again, massive herniation, another one of my patients, okay? All this black stuff is that jelly that's squirted out that if you went to a neurosurgeon, most of them are gonna cut that out on you and you don't need to get it cut. Look at the difference here. You can do this from home. Again, minimal. This is 12 weeks. This isn't 24 months. This is 12 weeks for these people. Massive rehydration of that disc. No low back pain. No sciatic pain, no muscle weakness. Back to an active life of hiking and traveling. Here's another person, another patient of mine. The main thing I want you to really see on this guy is I want you to see, so you see the white area right here? That's his nerve branch right there. So this one you can barely see, this one you can't even see at all. And look at this guy. This is 12 weeks later, and this guy was a big guy. Now you can see his full nerve branch. That's all done without surgery. Okay? You can do this without surgery, I'm telling you. And guess what? Even if it didn't work, you can always go get cut open. But once you get cut open, you're never going to be the same. Ask anyone that gets surgery. They're never the same. And you're probably going to need another surgery and another surgery. And I don't want that to happen to you. I want you to live an active, healthy life. And trust me, your body will usually heal a lot better when you help it heal the way it was supposed to heal. So let's look at some costs for a second here. So, if you go get spinal fusion, you're looking at $138,000. If you just have a laminectomy, okay, that's a big surgery too. That's $52,000 to get those surgeries done. And I guarantee you're going to have probably issues with failed back surgery syndrome. Dennis McClure said it. He goes, hey, if surgery fixed everybody, there would be no failed back surgery syndromes. So, I always tell people, if I could take my knowledge that I've had over the last 24 years of helping people with back pain, and I could just put it into your head and teach you what I know, here's some of the benefits that you would get. You'd probably have immediate pain relief or very close to that. I think you could avoid surgery in most cases. I could help you heal your spine instead of just patching it up. I give you hope for a better future. Avoid painful and dangerous surgeries, multiple ones, and help you become active again, doing the things that you love to do. But what if you don't take my course? And what if you don't learn all the things that I put in there for you to help you accomplish this? Well, you're probably going to have unnecessary surgeries because the doctor is going to scare you into them. Your probably spine's going to continue to be more painful. You're probably going to have debilitating pain at some point, perhaps. Depression is a real thing with low back pain, and then people start taking drugs to manage that and numb themselves, which is bad. Anxiety of their future, that's not a way to live. You should be excited about your future. Painful injections, epidurals, staying in a hospital because of these surgeries, and living on pain medications or getting addicted to opioid medications, which happens in the United States. I mean, that's not new news to anybody. Those are big things, and I don't want that to happen to you. And it's all just because you might not know what I know. So what did I do? Well, I created a course for you called DISC University. DISC University, I created one for if you have suffering with low back issues, there's DISC University for your low back. And if you have neck issues, there's DISC University for your neck. If you're suffering with these, I teach you everything you need to know. Everything I would take you through if you came to my office when I was working full-time over a 12-week period, from core strengthening to flexibility, how to get out of bed, how do you hydrate your disc properly, nutrition for your discs, how to do spinal decompression. And I send you the piece of equipment as well. I tell you exactly what to expect after your first treatment, after your first week, your second week. So it's like me being there, and then I do your lives for you like this every week. So if you have questions, I can answer them for you as well. So you can do all that for $997, and that includes the decompression unit that we send to your house, and it's yours to keep so you can continue to keep your disc healthy after you do your initial treatment. So, and today, I've never done this before, but today I am giving a coupon code for everyone that has joined us for our live today. And so if you go into right here where it says coupon code, we're going to send you a link here to the course. If you type in Relief 20, I'm giving, for the first time ever, I'm giving a 20% discount to you. I'm only offering 10 of those to people. So after 10, it will not be up. So just keep that in mind. If you type that in, you get 20% off the course, and including the piece of equipment. So there are the links. Marisa, thank you so much for putting those up. I want to thank you today for joining us. My passion, my mission is to change the way that we manage spinal pain in the United States. Thanks so much, Marisa. You're the best. People, we have to do something different. And I want to give you an opportunity that I've seen over and over and over again, watching people get their lives back and be happy again, and not have to fear about surgery, not have to fear about injections, not have to fear about adverse reactions, infections to the spine, being disabled, like my uncle did, because he went and got surgery and he wouldn't go and get natural health care. So I created DISC University. It took me over a year to create this course for you. I put a lot of work into it. I think you're gonna love it. I think you're gonna be amazed. You're gonna feel so empowered. And the cool part is that you can start having pain relief even sometimes on day 1, which is just phenomenal, and without drugs and without surgery. So I hope you please go take a look at it. The links will show. You can watch a video there. I kind of went over a lot of the highlights, and I'm giving you 20% off today too. So I hope you'll take advantage of that and let me know, because I want to know how you're doing and I want to hear your successes, okay? I appreciate you so much. Thanks for being with us today. If you have any questions, if you got our email, my telephone number's on there. You can email us. You can send me a DM as well. I'm looking at them every day. I want to be here to help you get your life back. I can't wait to hear about your successes. So I will see you on the next webinar, and I appreciate you so much. I hope you have an amazing day.